everyone. We are really excited to have you here with us today to learn more about our new Doctor of Science in Integrative Health program. ACHS was founded in 1978 with a mission to make health and wellness information and education accessible to our global communities, and also to lead the advancement of information, wellness protocols, and education in integrative health and wellness. This doctorate program is a direct extension of that mission and is a culmination of many years of research, of curriculum development, and bringing together experts from across the industry. Some of you may know that in 2021, ACHS entered into a partnership with another accredited institution called Hawthorn University that was in a position of needing to close. And, we were able to work together as colleagues in the integrative health and wellness industry and collaborate to bring Hawthorn University into the ACHS community. And with that, we've had the wonderful opportunity to work with Dr. Janet Ludwig, who is here today and will be presenting and is now the ACHS Dean of Integrative Health and Nutrition. And she was also the Dean of the Doctorate Program in Nutrition at Hawthorn University. So this program brings together the functional nutrition curriculum and research that Janet and Hawthorn University had culminated, as well as bringing the expertise of ACHS's nearly 50 years of aromatherapy, herbal medicine, and integrative health experience. So today you'll also get an opportunity to hear from our Dean of Aromatherapy, Amanda Lattin, our Dean of Herbal Medicine, Dr. Glenn Nagel, and our Dean of General Education, Dr. Lori Holdren, who will be talking about opportunities for an interdisciplinary degree within this program, as well as then the specializations in aromatherapy and herbal medicine. Some of the things that we're really excited about with this program is, of course, the opportunity to specialize in areas where ACHS has been a leading expert for so many years. This program is one of the only, in fact, maybe the only accredited doctorate program with an aromatherapy specialization. And it is a program that focuses on experiential learning and research and practical application. So students that are working through their dissertation are going to have an opportunity to really make a meaningful impact on healthcare and the integrative health and wellness industry as they go through that process. We're also excited about the way this program is structured. It is designed as a 3-year doctorate program with tremendous support from starting with admissions to student services and advising, to the doctoral committee that students will be working with to help them achieve that completion. Writing a dissertation, completing this research, that is no small task. And we're very excited about the support that we've created with this program. And we know that everyone who comes into this program is going to have an opportunity to be successful and really make an impact. We know that that is something that drive to make an impact, to help others live a healthier lifestyle, is a common thread that brings us all together here at the ACHS community. So with that, I'm pleased to turn it over to Dr. Ludwig to begin to tell you more about this exciting program.
Oh, thank you, Tracy. Wonderful introduction, and I'm so delighted to be here. Following with what Tracy had indicated, today we'll cover what is integrative health and why this program is important. It's important to indicate to you why you should enroll in this DSC program. We'll cover what you'll learn. As Tracy has already indicated, we are so proud to have degree specializations, and those will be clarified by the deans. We want to indicate who should be taking this program to be successful and how you will be using this degree, either to extend what you're already doing, changing careers. And we have the admissions team here. We'll talk about the admission requirements, and we'll go through the curriculum. Finally, we will finish up with how you can actually apply, and if you have any questions, and then of course we're going to open it up to questions. And please feel free to include questions as we go through the process. So next slide, please. I have to go through this because I am so excited about what integrative health is. It is actually the combination of using some conventional medicine, complementary and alternative medicine, and of course, self-care. And you, in the role of integrative healthcare, you will be incorporating the modern science with the holistic approaches that has been around for a long period of time. You'll actually be a bridge between conventional medicine and the person that is being needs work in healthcare. The healthcare system, to me, is a complex ecosystem, and we assist you in how to navigate and to help people through this program. That's the main thing. We have a practical, individualized wellness support strategy for you to be delivering optimal health and whole body health for individuals, for groups, for corporations throughout, and for education. Next slide, please. Okay, need for integrative health. I've indicated already that the need for integrative health professionals is blossoming. That's because so many people are using it now, and you can already see the monetary benefit. In 2021, this is for the United States, this is $18 billion, has gone to just complementary and alternative medicine. Now we know how much money goes into Western medicine, the conventional medicine. So combining this is a big chunk of money, and more healthcare practitioners are needed for this. It is estimated that there will be a continued growth of 23% all the way up through 2030. So you're in the prime spot with this degree to be able to deal with this. Next slide, please. Why you should be enrolling in this DSC program. I'm going to turn this back over to Tracy, but before I actually do this, I do want to give a little background on the fact that this is a doctorate of science. This is not a PhD. PhD is the highest terminal degree you can get in any field. This DSC is the highest terminal degree that you can get in sciences. That's the difference. The role is different, but you can still do teaching, research at the university level, but then you can go out and become an author, you can become a practitioner, you can work with other practitioners. Additionally, with the Doctor of Science degree, you are not treating people. You are not curing and treating people as patients. You, of course, will deal with patients, maybe through a practitioner, a clinic, but be aware that you are not an MD, you are not an ND through this program, or a doctor of chiropractic. So I wanted to make that clear in case some of those questions come up. So Tracy, would you please go on with this? Next slide.
Yes, thank you very much, Janet. We have, as I shared, been developing this degree for some time. Many years ago, we added our associates, then our bachelor's, then our master's in integrative health. And so in culminating this degree, this terminal professional degree, we really thought about how this degree could help students have the best impact in healthcare. And this program was developed to contribute to the research and advancement of the integrative health industry specifically. It comes at a time when our healthcare system needs integrative health, a focus on prevention, and an individualized whole health focus really more than ever. I think the last few years have really clearly demonstrated that individuals want to know how they can improve their health and also how they can help their communities really thrive. This program was also developed to support a demand for trained professionals. As Janet was just sharing, the growth in the industry is expected to be tremendous. And currently there is a shortage of trained professionals. Of course, it's also designed to provide a pathway for our master's students who have been asking us for an opportunity for a terminal degree in this field because there are so few accredited degrees in integrative health. I see a question in the chat box that I am just briefly going to pause for, and that's a question around working with clients and giving advice. And this is something that we do talk a lot about throughout the program, really throughout all of our programs. The position, the consulting and coaching role of someone who is an integrative health professional is designed to provide education, to provide coaching, to really empower others to make choices that support their optimal health. And that can be done through a wide range of protocols. So definitely educating about the use of essential oils, through the use of herbs, the use of functional nutrition, nutraceuticals. And so that's really the emphasis in an integrative health professional role. Now, these professionals would certainly be well positioned to work with other healthcare professionals like physicians, nurses, other types of specialists. It is only medical licensed professionals who are able to treat, diagnose, cure, and prescribe. And that's a very specific curriculum that would be outside the scope of what we could offer, and also outside the scope of what can be done at a distance. So some of these programs have introduced online courses that can be a supplement to the curriculum, but there are not any of those that are able to be done fully online without a clinical rotation as well. So some of these are things that you would have an opportunity to talk with Janet as part of the admissions process. Each applicant meets with the Dean of Integrative Health and Nutrition to discuss, if this program is going to be the right one to position you to achieve your goals. Your admissions advisor will also be an important advisor and coach along this process. We really work with each student for all of our programs to make sure that it is the best program to meet their needs. And if it isn't, we're happy to share other resources for you so that you can continue on your pathway. Next slide, please. There was also a tremendous amount of research that we looked at in developing this program, because we really want graduates to be prepared when they go out into the industry, and we want them to be getting experience as they go through the program. So Janet already shared some of the growth that's happening in the industry. You've probably all experienced it in your communities. There's also been a tremendous increase in the consumer use of integrative health and wellness. There's also been an increase in recognition of holistic protocols and practitioners by medical insurance policies. There has been an incredible growth in employee wellness programs. Employers realize that well employees are happier, engaged, contribute more to the professional community. It's a win-win for everyone. And the pandemic has certainly been a catalyst for healthcare centers to be incorporating more alternative forms of healing for preventative measures. Some healthcare facilities, I know here in Portland even, will offer you things like aromatherapy and herbal tea while you wait. So, that is, I think, really showing tremendous growth in the recognition of integrative health. I am seeing a number of questions in the chat box. So when we transition to the next speaker, I'll be sure to take a moment to review those, and we'll come back to them a little bit later in the webinar. Next slide, please. So here, I'm going to turn it over to our next speaker to discuss more about what you'll learn in the program.
Right. That would be me. Janet again, and thank you for covering all that information relative to the process and the role. Next slide, please. Indeed, this, as we've already indicated, it's designed for health and wellness professionals, practitioners, educators, healthcare professionals that are going to be driving the advancement of this integrative health and contribute to research in the field. And my role as interviewing you is to make sure, as Tracy has already indicated, that this is a good fit, because we're investing time in you and you're investing time in your program. And we need to make sure you're successful with this and it's a good fit. We will guide you to develop the skills, practice those skills. That's so important to get out in the field. You'll be working with volunteer clients, and educating others. You're applying this in professional and clinical settings, and you'll be contributing to global and community health. So important. Next slide, please. Of course, you're going to be going through current research. At the doctoral level, you yourself will be not only finding research, but presenting it in Zoom meetings to colleagues, to other professors that will be participating in that. We need to have so much information covered in this program, and you're going to be the one finding it and presenting it. It's called a journal club. We'll have that as part of it. You're going to be using the research and the theory to identify and design integrative protocols. In your second course in the program, you'll be actually becoming certified. You're taking a course through NIH to know how to work with clients, protect their privacy issues, make sure you have no bias as the researcher, making sure that cultural and activities of the participants that you'll be using with are being respected. That's a certification you'll get through the NIH that will be yours for years. We also, of course, want you to be working with and developing coalitions at not only at the individual level, but all the way to the global, national, state, and the community organizations. We've had students in these programs that go into their children's schools and talk to them about their the lunch programs, bringing in farm to schools programs. You will be evaluating the impact of ethical, socioeconomic, and the racial issues. All of this is done because it's so important to be respectful of culture and what makes us people. Next slide, please. You're going to be implementing some of these that, as Tracy has already mentioned, you could be working in nutrition, aromatherapy, and herbal studies. Each of those have the scope of practice and code of ethics. This is so important that we will be teaching you to make sure that you are not going out of your scope of practice. So important. And of course, doctoral dissertation project, best thing when you get to that point. We are encouraging you to design, conduct, publish, and present your findings of the doctoral program. Throughout the program, we encourage you to develop even some of your assignments into posters. I've gone to conferences with students where they've presented at these conferences. This is going to give you networking as well as the practice of presenting some of this information. So all of this is so important, and we need to get you out there into the professional field. Next slide, please. Continuing on, you can be developing a specialization in functional nutrition, physiology, and lifestyle and wellness. We've already talked about aromatherapy, herbalism as the specialties. And each course, believe it or not only will you be in Zoom meetings with colleagues, you will also, each course, you will have an oral conference with your professors. They will be making sure that you are understanding the material that has been presented and making it flow into what's going to work for you. We also have connections through some of our advisory committees such that you can do some externships, especially at the doctoral dissertation level, where you may be linked with a supplement company and exploring something that will be useful to them. And as we'll show you later, graduates of the Hawthorn program where they've gone with their dissertations. So next slide, please. I've already indicated the NIH certification. I'm very proud of that because people can walk away with that right now and get that. You're going to develop communication, teamwork. Healthcare system doesn't work without teamwork. You'll be working with MDs, PhDs, NDs, chiropractors, all at terminal level. And as I've already indicated, science conferences, you'll be doing presentations and working towards those throughout your program. Next slide, please. All right, degree specializations. I get the joy to turn this over to the other deans because they are so enthusiastic and passionate about their topics. So next slide, please. And I think, Amanda, I think that is for you, Dean of Aromatherapy.
Thank you so much. Hello, everyone. It's very nice to meet you. My name is Amanda Ladden, and I am the Dean of Aromatherapy at ACHS. I am a registered aromatherapist and clinical herbalist, and I've been working in the integrative health field now for close to 20 years. We are really proud of our aromatherapy programs and courses at ACHS. We were among the first to have accredited degree programs in aromatherapy in the United States, and we had the first accredited Master of Science program in aromatherapy in the United States, and it's a big accomplishment. Aromatherapy is a cutting-edge integrative health modality. We are finding it more and more incorporated into traditional clinical settings, as well as being incorporated into many different types of integrative health modalities, such as acupuncture, chiropractic, naturopathy, massage, and some specialized areas such as palliative care and oncology care are really accessing the latest research on aromatherapy to support patients in those areas. So aromatherapy is a standalone modality that can be utilized to support people with a number of different types of health imbalances, but most often we find it incorporated alongside other modalities, such as the ones that I just mentioned. And I've seen a lot of questions in the chat box of what can you do with this education? And I can say, over the last 20 years, I have had so many opportunities to work in different settings. Even though I'm not diagnosing and treating a disease, I have had just an incredible opportunity to bring aromatherapy and herbalism to so many special people and to collaborate with many other types of practitioners. And I don't know if I would have had that opportunity if I just had one license, to be honest. And I've been very proud to get to help design different aromatherapy research studies, and we're seeing more and more interest in understanding how to incorporate aromatherapy into medications with like nanoemulsions, for example, for supporting IBS. And many of you probably have seen the Selexan available now, which is a lavender essential oil preparation for anxiety. So essential oils are a very exciting component of integrative health, and it's lovely to see how they really truly are becoming integrated, where you can see them in real, complementary and alternative settings, as well as scientific research or clinical settings. So aromatherapy is the controlled and intentional use of essential oils to support health and wellness. So it has a really broad umbrella. In the United States, that pretty much involves topical or inhalation applications of essential oils. But as I mentioned, there are now standardized preparations of essential oils being developed, for internal use. Depending where you are in the world, you're going to see essential oils utilized differently. For example, in Asia and Europe, they're more commonly accessed and integrated into pharmacopoeias. So knowing about them gives you a real edge in the integrative health field, because this is a really desired component of integrative health. We see many holistic nurses being asked to incorporate this into patient care in hospitals and in specific settings. So it is so versatile. It's very non-invasive. It's enjoyable to use. It's really, really incredibly beautiful to study. Everyone that I have taught aromatherapy to has been impacted by studying aromatherapy, because I always tell someone, you're smelling it too. So whenever you give someone aromatherapy, you're really receiving aromatherapy. So it's a very unique modality to study. I think once you get involved in it, you want to keep learning more. You want to keep learning about more plants. You're very excited to get to smell each essential oil whenever you get it, no matter how many times you've smelled it. And it's such a blessing to get to work not only with your own clients, but then to support other practitioners in helping them to incorporate aromatherapy into the work that they do. So we have graduate level aromatherapy courses available that you can incorporate into your doctorate program. You can also focus your dissertation around aromatherapy research if you chose to, and we would support you in that. And there's not very many programs available where you would have that option. So, and to have experts in the field to be able to support you with it. And we do have an incredible aromatherapy faculty at ACHS with clinical experience, research experience, very unique and just wonderful to experience and learn.
Thank you. That was wonderful. We'll pass it on. I guess I go next. And it's wonderful to follow you, Amanda, because of the fact that we use aromatherapy in eating. Everybody eats, right? You either like the smell of the food and you'll eat it, or if it smells horrible and putrid, you may not eat it. So aromatherapy is integrated relative to that. And as going on with this specialty, this functional nutrition will assist you with knowing the specifics related to pathological conditions. You'll, of course, get a solid foundation of all of the nutrients, nutraceuticals, and lifestyle protocols. We will be supplying all of that to you to develop and use throughout. But it's important to know that the functional nutrition at this level, in the upper level courses, is focused on the body system diseases and trying to and working with volunteer clients to improve their health. So you will be getting all of the questionnaires and some of the help to deal with that. So going on with our specialties, I'm going to now pass it off to Dr. Glenn Nagel. Next slide, please. And Glenn, would you please tell us about herbal medicine?
Yes. Hello, everybody. So glad to be here. My name is Dr. Glenn Nagel. I'm a naturopathic doctor and herbalist. And this year is my 30th year as a naturopathic physician licensed in Oregon. I've been an instructor at the naturopathic school here in Portland. I've been in the herbal industry, working with formulation, developing products. And I've taught for most of that time as I'm teaching here in our graduate and our undergraduate program. Now, what's so exciting about herbal medicine is everybody comes to our school knows about herbal medicine, either through family members or through their own use. And the awareness is very high. What's new today is there's so many resources advancing in herbal medicine. It's being integrative. Every week, students do research, and we find a tremendous amount of integrative research on herbal medicine. And so it's become more and more mainstream, even though it has deep roots. So everybody may have a background from a family or a historical or generational use, but now we're integrating it with science. And so that blending of the two puts us squarely in the middle of the integrative medicine. And I like to think of the herbal medicine in the middle. And then on one side is nutrition. And on the other side is of the coin is aromatherapy. All the aromas that we study in the aromatherapy program come from plants. And so in a way, herbal medicine is the foundation, and these other aspects branch out because, of course, there are many herbs that are very nutritional to eat. They have micro and macronutrients. And so the herbal medicine that we have in this program at the graduate level really gives you an understanding of the science and the research potential that you can then integrate with nutrition and aromatherapy and apply it into a clinical setting. Our students go on to do research. They do their own studies. They write for journals. They work in their own businesses. They set up businesses and manufacturing for herbal products. They become experts, influencers, bloggers for herbal medicine. And so it's so exciting that the graduate program with in our herbal medicine is allowed to be used to have in this doctorate program, having a focus in herbal medicine. You can take one of our, I think, 12 herbal medicine graduate classes as part of this doctorate program. So it's very exciting. I'm happy to answer any questions as we get to the final question and answer period.
Good. All right. And I think our next presenter is Dr. Lori Holdren. She'll explain this.
Hi there. As part of your degree, we have an actual interdisciplinary choices that you might go to. And if you've already been a graduate student here, you may have taken some of our anatomy and physiology, coaching, and pathology and pathophysiology courses. And those could also be taken as elective credits if you haven't taken them as part of those programs to help you expand your knowledge base and help you assist in depending on what career you're going to be going into. So I'm the Dean of General Education. I oversee those classes, and we are looking to see what other options we can also bring onto the foreground as we develop the degree further. I think we're back to
Yeah,
Dr. Bennett here.
I think so. That was so wonderful. Thank you so much. And I get the pleasure of talking to you about, again, the doctoral dissertation project. It's 12 credits. As I've already indicated, we encourage you to actually do an experimental study. That does require more forms because you'll be working with people, institutional review board forms, which we have at the university, that your proposal for an experimental doctoral dissertation. If you're working with humans, you will need to go through that. You can also do a very extensive literature review, similar to your capstone project and or your thesis. If you've done a master's, you can even expand upon that as long as it's new information, you're filling a gap in the research, and it can be presented throughout the program. We also encourage healthcare protocols. Of course, I would like, if you're going to do a healthcare protocol, that you actually develop it and implement it, but in some cases, you may not have that opportunity to do it. An example might be to reduce obesity and increase exercise in school children, and going actually into talking to them about the at the schools, at the exercise physical education roles. Now, we've already alluded to this. You will have a committee for your doctoral dissertation project, which is 3 members. You will have a chairman that will be on your shoulder, looking over everything that you do. And it's your choice of who you wish to work with. And I will advise you on who you are going to have for a chairman based upon what your topic is, as well as, of course, the expertise of our esteemed faculty members here. Now, you will have 1 chairman and then 2 other members from either the university, the college here, faculty members. We do have the caveat such that 1 member can be outside. That's been facilitated as long as the individual meets the qualifications. They have a terminal degree, they have all of the requirements, and they would come in upon approval from the Dr. Tiffany Rodriguez, myself, and the president to make sure that your committee is 3 members. You have committee meetings throughout this where you are talking to all of your committee members. Oftentimes, the Dr. Tiffany Rodriguez and president will be coming in to make sure that everything is going well. So this is going to be giving you practice throughout your 12 credits courses that are part of this dissertation, to get practice, because you're going to be the expert. You're the smartest individual in your field when you graduate, okay? And this is where you're going to be presenting it to us as the expert. Next slide, please. As we've already indicated, as Tracy had indicated, this program came over from Hawthorn, which was a holistic nutrition program, but we, of course, expanded it to include all of the other specialties. These are successful projects, dissertation projects that were done at Hawthorn. I'm so proud of this one, multimodal dietary treatment and Tourette syndrome. This was even supported by a 3rd person that was an MD at the Neuroscience Institute. A grant was provided to cover some of the lab tests, some of the nutraceuticals that were given to these individuals. This was a program to reduce the symptoms of Tourette syndrome over a period of 6 weeks. Again, we did go through an IRB committee, not only for the institution, but also not only for the college, Hawthorn, but also for medical center, to make sure that all was done properly. And the results were incredibly positive to show that if these people were put on a diet, stress release, exercise program, they actually decreased their level of psychotropic drugs they took for this Tourette syndrome. This was a very exciting study that I was part of, and publications have come out of that. Another one was done with an individual who works with athletes. She proposed a nutritional education to support long-distance runners and afford them opportunity to improve their health and lower their body weight. And indeed, she implemented this into long-distance running members who did marathons, and she showed that the 6-week program prior to the tests, they did have better performance than the ones that did not participate in the program. Again, this was the foundation for her work now, which advises and supports athletes throughout the program. Next slide, please. Now that was the experimental. We can, as I've already indicated, you can do a literature review and you can do a healthcare protocol. Now this one was so exciting. This individual, I think because of the fact that she had cardiovascular disease in her family and lived in an area where it was at high risk, she showed that the municipal city water, if it was at low levels, then it linked with the cardiovascular disease rates in that geographical area. Doesn't mean it's causative, but she did show the relationship of it. This was a very extensive protocol that she put together that matched up municipal low waters of magnesium in municipal waters and cardiovascular disease. And publications came out of this one. Healthcare protocol, this individual did develop a 21-day purification program. She worked with, it was only a pilot study, but she worked with a few people to improve their health. And I think this was about a 6-week program. There was improvement in these individuals. This program then became the basis of her work as a healthcare provider that she implements and sells this 21-day purification program, as you can imagine. Next slide, please. Now, who should be taking this program? And I'm going to turn this back over to our president, Tracy. Next slide, please.
Well, thank you very much. I just have to say, I am so excited by all of the questions that have come in through the chat box and the Q&A. I can see several blogs in our future sharing more information. You've just all asked really thoughtful questions, and a few of us are trying to answer them as quickly as possible as they come up, but please know that we will follow up, and we'll also share the responses that we've already sent out. So just thank you so much for your engagement. It's really exciting for us. For this program, we are really looking for learners who are wanting to expand their knowledge, who are looking to facilitate change in the healthcare industry, that also facilitate change in their own profession, perhaps. But we're really looking for people who are going to be making an impact in the health and wellness industry. We're certainly providing a pathway for our students and graduates and the former Hawthorn University students to expand their education at the doctorate level and be able to really take it out into the industry here in the US and globally. And we're looking to also provide a pathway for healthcare professionals who may be coming from an allopathic conventional model who want to integrate health and wellness in their practice. I talk to healthcare professionals all the time who want to know how they can really integrate this in their practice. Some have capacity to do it themselves, to take an educational program like this, and some are really looking to partner with those who would be graduates of this program. So that's a little bit about the students that we're looking for. Generally, we're looking also for students who have that, innate curiosity. You want to know, and you're interested in what could make things better. Why things like supplements, macronutrients, micronutrients, herbs, aromatherapy, how those things work in the body, and thinking about new and innovative ways that they could be applied in the industry. There is so much opportunity in the integrative health and wellness sector right now, and it's really waiting for you to bring your ideas and innovations. So that's a little bit about who we're looking for in this program.
Great. Thank you. All right. I think I'll take over at that point. Thank you, Tracy. That was fantastic. Next slide, please. As continuing on with what Tracy has already indicated, we are assuming that you will be using this, obviously, as healthcare nutrition professionals. Being in dietary supplement manufacturers, we have one manufacturer, his business is in Las Vegas, as well as we have a supplement company that's in New Zealand. They have a very piqued interest in this program, such that they can be getting out of the program people to work for them and deal with it. Of course, being educators, doing research in academia in the corporate sector, and health and wellness professionals, such as indicated by some of our graduates, writers, speakers, and authors. And I think my next slide shows some of these successful persons. Next slide, please. Yes, this is a Hawthorn graduate, Sheila Dean. She came in as a registered dietitian, and she has accomplished all of these things. And as a function of her doing the DSC program, she teaches, she advises, she has expanded her profession a great deal as a result of that. And again, Hawthorn University program, this was a holistic nutrition program. We've now expanded that to give more opportunity. Next slide, please. Is again a person who, she actually wrote her dissertation on the pleasures of eating. It was, and she did an interview. It was an experimental process that she had done. As a result, she wrote a book. It's the Real Food All Year. She teaches, she is a speaker, she has, as well as doing client work. Next slide, please. I'll quickly go through admission requirements. We have the director of admissions here too, who can answer questions if they come up. And I'll go through curriculum too rather quickly, because I want to make sure we have enough time for some questions relative to this. So next slide, please. To be a successful candidate for the doctoral program, you need to have a master's degree, and it can be in any field from an accredited institution. And if it's a non-science master's, you may have to take prerequisites. That's one of the reasons you're going to talk to me prior to this, as well as if you did not write a capstone project or a thesis, we may want you to do some research background. Obviously, you will apply for admission. We want the successful person in this program to be able to commit at least 9 hours per week per the 3 credit courses. Some of our courses are 12 credits, so you need to be able to commit per course 12 hours per week. And you will meet with me prior to, during this admission process. I mainly want to make sure that you are qualified. We're both going to, like I've said, the institution and our instructors, our faculty will be putting a lot of time into your program, and we want to make sure that it's the right fit for you. And of course, ask questions of me of what's going on. Next slide, please. Curriculum. I'll quickly go through this. The actual program curriculum it's a 60 semester credit program. 44 of those credits are core credits, and then 16 are elective. Some of these courses in the DSC program are 4 semester credits, and the curriculum can be found on the website at this link. Next slide, please. A little bit of a noisy slide, but let me walk you through it. These are your foundational courses. This is information that we have put together because of the fact that we believe that global health and nutrition, and the politics involved in it, and the policies that are implemented that impact our health is so important, and you'll be dealing with that. Your research in bioethics, you will actually have the option to write a grant proposal as a template that's in there. And as I've already indicated, you will be getting a NIH certificate in dealing with human subjects. Environmental health. Are we all exposed to the issues from cars? And I live in California. They're now putting bans on diesel vehicles. Can't even come into the state now. That's incredibly important. The gastrointestinal process and detoxification, and of course, inflammation, the core of disease. Those are going to be your foundational level courses. You will then take an exam before you proceed to your upper level courses, and which you will be taking your 16 credits of elective courses, which are on the next slide. But then when you come back after your elective courses, you're going to be taking a course in biostatistics. That's so important for your dissertation. Your directed study, this is basically a seminar course where you will be testing the waters for what you might want to do for your dissertation. And then after all of this, you will take a comprehensive exam, which has a written portion as well as an oral portion. It will be based on all of the material to make sure that you're confident with moving forward into your dissertation. These are your dissertation courses. They are 3 courses here, 4 credits each. This is where you'll be working closely with your chairperson and your committee throughout these 3 courses. Next slide, please. These are your elective courses. Professor Latin and the deans of herbal and well as herbal studies, Dr. Nagel and Lori Holdren, who oversees these level of courses you've already talked about, as well as new courses are coming into these programs. And these are new courses that are still in nutrition. This would be, if you chose to take these, this would give you your specialty in functional nutrition. Okay. So these are the elective courses. Next slide, please. And in the program, students may transfer up 9 credits of study into your doctoral program. These can be from your ACHS program, and they may come from another accredited university at the level that would have to be reviewed. And the registrar's office will be evaluating this transfer of credit. And like I've said, we've got the director of admissions on this call, so on this meeting, so you can ask questions relative to that. Next slide, please. Again, I'll quickly go through this. Next slide, please. This is how you will get started. And it's important that I emphasize you will have a team to walk you through. Your application process is here. Transcripts would go to this. You will have an admission advisor, and that's when you will also schedule a time to meet with me. You will receive your recommendation for admissions. All of this and the academic plan will need to be done by August 10th to get you in for the fall program. Okay, next slide, because I want to show you. We have an incredibly supportive admission teams. They will do all of this for you. You'll have a dedicated advisor. They will help you prepare your application. They will coach you, as well as I will assist you with the best program for you and the specialties for you. And our next slide is indicating who those people are. And at this point in time, I'd like to open it up for questions. We're kind of right on time. Any questions that have come in that we would like to have open at this time and contributing more to what we've talked about?
I would like to add one more thing, and thank you so much, Janet, for covering all of this and for everyone who's contributed today. This information, a recording of this presentation, as well as the slides, are going to be sent to everyone. I just saw that question in the chat box, so I wanted to let you know that. There's a lot we've covered today, so I'm sure you'll want to refer back to it. And I also wanted to share about some of the tuition options. We've had some questions in the chat and in the Q&A about funding this program, and there are several options. At this time, we have options for semester payments, monthly payments. We have employers that we work with for employer funding. We have students who may receive scholarships or other types of grants. And for this doctorate program in particular, we're exploring new options for that, because there definitely are funding programs, some of which Janet was mentioning, for example, on the research side, to help support doctorate students. At this time, the program is not eligible for financial aid, federal financial aid, or veterans education benefits. However, we are continuing to expand those offerings. With something like a new program, it takes a little bit more time on the regulatory side to be able to offer that, and we'll certainly keep you posted. Our goal is also to help you find a sustainable way to fund your education. We really want to exhaust, all of the resources that might be available to you so that you can graduate without student debt, if that's at all possible. And that's something that's an important part of our mission across all of our programs. For those of you who have been with us in other programs and maybe worked with financial aid, you know that we spend quite a bit of time talking about, borrowing, what it might mean if you do have student loans when you graduate. We want you to be able to have resources when you graduate to put your studies into practice. So our goal is to help you graduate with as little student debt as possible. So we'll keep you updated on any new funding options, and your advisor will be able to counsel you on options that might be the best fit for you. We're also able to help with completing applications for funding programs. We can provide program information. Our advising team is really experienced in helping you do that. Certainly myself, our Chief Academic Officer, Tiffany, and the program deans are always happy to help you explore those options too. So if you have any ideas or things that you're looking at, let us know. And I really encourage all of you on the funding side to connect with the community organizations that are local to you, nonprofits, church communities, and certainly employers, of course, but there are a lot of organizations that do have funds available to help people in their community who are looking to give back to the community through a program like this. So sometimes maybe it's just a little bit. Maybe they have $500 to offer as a grant. Every little bit of that adds up. I know Amanda Heller on our admissions team, our director of enrollment services, she has done several webinars and talked about her experience in higher education funding her degrees with scholarships. And, it was no small feat to achieve that. And I think, Amanda, you shared how every little bit made a difference. So let us know how we can support you in that, and definitely work with your advisor. That's really the best next step, so that we can help you determine if this is going to be the right fit for you right now. And I say that because even if right now isn't a time when you can start, we'd love to continue to work with you and see when it might be a good time.
Right. So important. And even through the coursework as a student, you will learn how to write grants, and writing them for supporting your education is going to be possible too. So important and very efficient to get that done. All right. Do we have more input?
Let's see. I see a few other questions that we may not have covered yet that are a little bit tied to more specific questions, individual questions. So those we'll follow up on. As I mentioned, we'll be sure to save the chat box so that we can be sure to follow up on those. And I want to be sure everyone does have that contact information. I'm going to actually put the admissions email in the chat box. And if there is a question you have here that we haven't covered, please also feel free to send it to admissions. And Amanda and Troy, who are on with us today, will make sure it gets to the group, and we'll collaborate with you. So I think we have just about covered everything that we have time for today. And we'll definitely be looking forward to connecting individually with all of you.
All right. Are we good to finish up? And please contact all of us if you have any questions.
Well, thank you so much to Janet and the program deans. We really are proud to be presenting this degree to you, and we look forward to all of the incredible advancements that graduates of this program are going to achieve in the industry. So looking forward to connecting with you all and hope we talk soon.
Good. Thank you all.
Bye, everyone.
Bye.